Thank you for joining us for another edition of Icon Medical Billing Industry News. For a free assessment of your medical billing needs, please contact us at 888-678-5597. Today's topic is Advance Beneficiary Notice of Non-Coverage, or ABN, for billing Medicare patients. Advance Beneficiary Notice, or non-coverage, or an ABN, is a notification healthcare providers issue to patients prior to billing Medicare patients. This notice is to let patients know that Medicare may not pay for certain tests or services before having the tests or services performed in outpatient facilities. The information allows patients the option to decide whether to avail of the services with acceptance of full responsibility of paying the bill or not. Providers must follow the guidelines set by Medicare regarding the issuance of ABN prior to billing Medicare patients. Providers who fail to issue an ABN to Medicare patients cannot bill them for services not covered by Medicare. An issued and signed ABN authorizes the provider to proceed with billing Medicare patients for the non-covered charges. When an ABN is not issued, the provider is restricted from billing the non-covered services to the patient. Providers must be knowledgeable about what services are not covered by Medicare. A valid ABN must contain the provider's name and contact details, name of patient, and HIC, or Medicare Health Insurance number, non-covered services performed, cost estimate for the non-covered services, and the signature of the patient or representative with the date of the signing. If a patient opts not to sign the ABN, the provider must include this information in the ABN in critical cases where services are needed to be performed. If not, it is advisable not to give the service to the Medicare patients who refuse to sign the ABN. If the services are performed without a valid ABN on file, the provider cannot bill the patient for the services that are non-covered in the event Medicare denies payment. The following text is a guideline of several requirements for documentation of claim forms for non-covered outpatient services reports when billing Medicare. Indicate the date when the patient signed the ABN and enter occurrence code 32. Attach modifier GA corresponding to procedure code or codes listed on the ABN. This entitles the provider the right to bill the Medicare patient for charges that may be denied payment by Medicare. Attach modifier GZ corresponding to a procedure code or codes classified as non-covered by Medicare and not listed on the ABN, or when there is no valid ABN for non-covered services. Remember that every line item appended with a modifier GZ will automatically be denied payment. Use these modifiers responsibly. Covered services on billing Medicare claims appended with modifiers are automatically rejected. What are the services categorized as non-covered services by Medicare? The non-covered services are services performed that Medicare finds not necessary for billing Medicare patients. They are as follows, but not limited to: nursing home care and personal care services, unless for authorized skilled nursing care or facility; non-medical services, non-emergency transportation, and housekeeping services unless authorized for hospice; services related to general hearing aid use and hearing aids, experimental treatments and procedures, cosmetic surgery, chiropractic services, acupuncture.